Hi, everyone. Thanks for joining us today. I'm Monica Walker, VP of Chronic Care Services here at Harris. For those of you who may not know, Harris is the company that owns Prognosis. So I am part of the same organization. And actually, some of you may know me because I was a salesperson for Prognosis for several years. So good to talk to anyone I've talked to before today. Happy to be here presenting this great program to you guys. I have Dr. Josh Barron with us, and he is the subject matter expert at Enable Healthcare, who's our partner who is providing these services. Enable has been doing this for a long time, and we have quite a few practices who are signing up. So I'm going to turn it over to Dr. Barron. Thanks for joining us today, Dr. Barron, and I'll let you take it away.
Thank you, and thank you to our attendees for joining us. So I'd like to talk to you today about chronic care management and essentially how we can help with this program that has a potential to boost your revenue and to actually increase your patient satisfaction. So for those that aren't quite familiar with the chronic care management program, we will talk about what the chronic care management program is and how it benefits the 3 Ps, the patients, you guys, the physicians, and the payers. We'll talk about the strength of our CCM clinical staff and talk a little bit about the kickoff process. What would happen if you were to sign up to do CCM with us? So let's start with what the CCM program is. So this is a program that CMS introduced several years ago now. And the idea here is that through this program, we have the ability to bridge the gap in patient care. That is all the things that happen between one in-office visit or one telemedicine visit and another. And the idea here is to try to keep patients home and healthy. That is avoiding the ER, avoiding hospitalizations, and helping patients to remain compliant with their medication and lab regimen. So the idea here is that a chronic care plan is written based upon the patient's chronic conditions. And there are at least monthly contacts with the patient, whether they be text messages or phone calls. And the idea being that those phone calls would introduce and maintain the chronic care plan to the patient. And so the idea being that CMS, and actually they've proven this to be the case, that we're preventing patients, we're making patients less likely to be admitted to the hospital, to be admitted to the ER as well. So in order to qualify for the CCM program, a patient needs to have at least 2 chronic conditions that are expected to last at least a year or until the demise of the patient. And these chronic conditions are expected to put the patient at risk of death or acute exacerbation or decompensation or functional decline. So that's a very broad definition. So what that means, that broad definition allows us to explore many different chronic conditions, not just the things that may directly contribute to the demise of the patient, such as cancer or heart disease, but we can also look at more, if you will, smoldering diseases that can wax and wane over time. So issues like atrial fibrillation, depression, diabetes, hypertension, chronic infectious diseases, for example. So the nice thing for your practices is that the CCM program will actually provide increased direct revenue from the CCM program itself. So CMS recognizes that this is a really important condition, excuse me, a really important program, and several of the private insurers have realized this as well. So as of this year, CMS and the private insurers actually boosted their reimbursements for this program because they realize how important it is. So for every patient that you have on the program, the reimbursement will be $59 to $210 per patient per month, depending upon what geography you're in and also depending upon how much time is spent for that patient in that given month. Also, you have increased direct revenue because patients just like having someone checking in on them and making sure that they're healthy. So you have a way to connect with your patients, increase patient satisfaction, and thereby increase patient retention. And of course, there's a decrease in ER visits and unscheduled hospitalizations, leading to reduced healthcare overall. looking at a practice, a single physician practice where, let's say, there's 500 Medicare beneficiaries, uh, kind of a low number, and that 80% of those have two or more chronic conditions. So what we're looking at is 400 patients. Let's say that on the lower end, you are getting $60 per patient per month for a total monthly revenue of about $24,000. That adds up to a total potential annual revenue, again, for a relatively small number of patients, for a relatively low reimbursement of nearly $300,000. So for a revenue generator, this is a no-brainer. Of course, patient compliance improves. That is, the patient's care plan is reinforced, so patients remember to do what they're supposed to do, whether it's getting labs or radiology tests or just taking their medications on time. Similarly, your quality measures will go up, so your MIPS and your value-based care measures will improve. Again, care can be managed in the outpatient setting, which means that which means essentially that the dollars are coming into your office as opposed to the ER or the hospital down the street. And of course, patients love the fact that there's improved communication and that they are remaining healthier for longer. So unfortunately, this doesn't project very well, but what we can do is we can send this off at the end. This is an interview with one of our clients who has implemented the CCM program, and it talks about how it's impacted Dr. Hazarian's practice in a very much of a positive way, and also had a positive impact upon his patients, most importantly. So the hallmark of CCM billing is the 99490 code. And what that stands for is for the first 20 minutes of staff time directed by a physician or other qualified healthcare professional per calendar month. So what that means is time that's spent either working on the chronic care plan or time interacting with the patient in a non-face-to-face setting. And depending upon where you live, the reimbursements are between $59 and $84 for that first 20 minutes alone per month. However, if you reach a threshold of either 40 minutes or 60 minutes, you can bill the 99439 code additionally, either once or twice. So that really allows you to be reimbursed more for the more time that you spend with the patients or on their care plan. And so the 99439 code alone, one instance, pays $44 to $63 per instance. So for example, a patient in New Jersey receiving 40 minutes of time on calls or revision of the chronic care plan, you would bill the 99490 code that would pay $69, and the 99439 code once for reaching a threshold of 40 minutes for a combined revenue of about $120. Of course, if you spend 60 minutes with the patient, you could bill that 99439 code twice, and you could actually bump your revenue, your direct revenue, that is, to over $170. So let's talk a little bit, excuse me, about what happens once you sign up for the program with us. So the first thing is that we would meet with you as a provider and discuss your roles and responsibilities. And I would say that the practices that have the greatest success with the chronic care program are those practices that really talk up the program with patients. That is, they state their expectations for the patient and make the patient aware that people will be calling to check in on them, and also talk about the benefits of the program, that the program will allow them to stay at home longer, safer, to avoid the ER or hospitalizations. And that goes a long way in terms of getting the buy-in from patients. We would be responsible for performing the data migration to the CCM platform, and we would decide, or we would determine which of your patients are eligible based upon the insurance that they have and also the chronic conditions that they have. And then we'd promote the program. We'll send out a CCM introductory letter or a postcard campaign for your patients, and provide posters for the practice describing the program itself. We would spend some time setting up the CCM app for you and training you on how to use it. And finally, what we would need from you would be voice scripts where we would send an automated call out to the patients in your voice. and basically describing the program and encouraging them to participate in the program. Next, we'd want to meet with you to understand your patient's demography. What's your socioeconomic status? And most importantly, what languages are spoken by the patients? So we have a very talented team of nurses that speak many different languages amongst them. So we'd want to make sure that we have the nurse that would best work for your patients, speaking to your patients in their native tongue. We'd also want to understand any concerns that you might have regarding compliance, whether that applies to your patient population in general or to particular patients. We would draft the CCM care plans based on evidence from the medical literature. And of course, you as a provider would modify this as required for each patient. And also on this call, we would introduce our care coordinations and establish the number of practices that you have, what our protocol is for after hours, and any specific instructions that you might have for our nurses. We, of course, provide ongoing support. So what does that mean? Well, we know that you're going to have new patients as time progresses, so we'll do an ongoing data migration at least monthly so that we can figure out which of your new patients are eligible for the program. And then we'll also have bi-monthly meetings to discuss the financial pieces. We'll review the patients that haven't been seen in the prior 9 to 12 months. This is important because in order to qualify for the program, patients need to have been seen in person in the prior year. And we'll discuss with you the compliance measures that we have and what we can do to increase compliance if there are concerns there. So we've actually been providing CCM since 2016. So we've been at this for a while. And we see our trained CCM nurses as an extension of the practices staff. So again, we're trying to engage patients in the patient's primary language. We will, at the conclusion of the month, construct the note based upon our interactions with the patient. And we would actually have you as physicians, as providers, review the notes and then approve of them. Now, one thing that is important about the program is that in addition to contacting your office, the CCM program also provides for a plan for contacting our nurses for patient concerns. So in the course of a monthly call, the sorts of things that our nurses would review would be the medications, that is whether patients are having adverse effects, whether they're taking the meds as required, if they need any particular refills on the medications. We'll look for any particular signs of disease exacerbation. We want to make sure patients haven't had ER visits or hospitalizations that you may not know about. We would want to review the socioeconomic aspects of patient care and barriers to care. So for example, is the patient able to make it to appointments, or are there issues with transportation? And when that's the case, we can oftentimes help with that. We would ask, of course, disease-targeted questions and then detail any gaps in care and ensure that patients are staying up to date on their vaccinations, their tests, their procedures. And finally, we would remind patients of scheduled visits and encourage patients to attend those as maintained. So obviously there'll be times that our nurses will need to communicate with your practices. So what are some examples of those times? Well, let's say a patient requires an appointment that's earlier than a scheduled appointment. We would get in touch with your front office staff and facilitate that process. If a patient needs refills, of course, we want to communicate that to your office. If there's any particular concerns that a patient expresses about their disease getting worse or any other concerns for that matter, we would communicate that. Clearly, if a patient has an emergency room or hospital admission, we'd want to communicate that to you and also participate in the transitional care management process. And finally, if a patient's been screened and it resulted in an alarming result on, say, a depression screen, the PHQ-9, or a follower screen, we would, of course, want to communicate that to you to take the next steps in that patient's care. So I'm going to stop there and take any questions that you might have, and if not, we are available at sales@harrisccm.com. So I will open the floor to questions.
Yeah, absolutely. Please feel free to type those questions into the question box in the webinar. I do have a couple of questions that we've had some folks send us ahead of the webinar as well. We have a specialist who is asking what specialties are applicable for CCM, and then how does that work differently than with primary care?
Yeah, great question. So for specialty care for the CCM program, as long as the patient has 2 chronic conditions, the patient would be eligible. The one tricky thing about this is that only one physician can bill the 99490 and 99439 codes. So what that means is you just want to make sure when you speak with the patient that they're not already enrolled in a program, in the CCM program. But let's say you are a cardiologist who's seeing a patient for atrial fibrillation and hypertension, that patient would in fact be eligible. If you're a neurologist who is dealing with a patient with coronary artery disease and you're caring for them post-stroke, they would also be eligible.
I'm muted. We also have some pain management providers who are initiating this service. One of the things that we're finding that's super helpful is the additional information that they're already recording in their chart, even though they're not treating the patient, for instance, for coronary artery disease or some of the other issues, they're still required to have that information in their chart. So some of the documentation they're getting from the chronic care management program is supplementing the information that's already in their chart. And
Absolutely.
anytime the patients have a situation that arises with one of those conditions that the provider is not treating them for, then those patients are getting referred back to, for instance, their cardiologist if it's the pain management provider who's providing the CCM services. So we'll work hand in hand to make sure that the patients get the care from the appropriate resource as they have situations arise.
From the standpoint of patient care, it's not so important who exactly is initiating the CCM program. The end result is the same. The patient gets better care. Their care plan is being reinforced, and ultimately the patient will be a healthier person.
Absolutely. So the next question is, can you explain the TCM service performed by the nurses?
Yeah, let's see. I don't know if I have any of the nurses on right now. I'm not actually an expert in the transitional care management side of things. Let's see, is Priyanka there?
I don't think she
may not be. Okay. Okay. That's something that we can certainly get more information on and forward that on. If you wouldn't mind putting your email into the chat box, we can pass that information on to you.
Yeah, absolutely. And we will include some of the Q and answer in a follow-up email. The next question is, are we going to be able to come back to this? Someone who was a few minutes late. So yes, absolutely. We'll be sending a copy of the recording to everyone in the next 24 hours or so. So you'll have the ability to review this later, as well as the PowerPoint presentation. We'll share that with you as well. The next question is about the cost of the service. So the cost will be depending on your practice profile. So one of the follow-up items that I'm going to be sending is a link to my calendar as well as my contact information along with my cell phone number. So if you're interested in continuing the conversation, I'm happy to provide a price quote based on your practice profile. We've run a lot of numbers on the existing prognosis clients, so we have a pretty decent feel of what your patient population looks like. So I can definitely provide a specific price quote for you, as well as continue the conversation, answer any other questions. The service doesn't require any upfront fees, so we actually collect after the payments are received for the program, and we actually can bill those claims for you. If you're an RCM customer, then we coordinate with the RCM team to bill those claims. So either way, if you would like us to, we can handle the billing of the claims for you. And then again, you'll pay a percentage of the collections after the payments are actually collected. And that specific collection percentage, again, we can discuss that offline and provide a quote to your practice for your specific needs. Can we bill for Medicare and managed care patients too? So Medicare.
So Medicare managed patients, yes, so they are also eligible for the program, yes.
Yeah, and one of the things that we do prior to starting the program, we've got the program already going in multiple states, so most likely we have the information, but if this is a state that we're not providing the service already, we'll check with all of the Medicare placement plans in your area to see if there's any that don't cover the service. Typically they do. We usually find maybe 1 or 2 per state that don't cover the service, and we're continuing to check that every now and then just in case they change their policies. But for the most part, about 90% of them are covering this service as well. Can a facility purchase the clerical portion of the program if we want to call our own patients? We did have another practice inquire on that. And yes, we can provide pricing for just the clinical aspect of it, as well as a demo of the software piece if you guys are interested in that.
Absolutely.
How would you manage the patients having copay or deductibles? You want to take that one?
Yeah, so in my experience, I have seen some clinics collecting those copays, and others they have actually waived the copay. But more importantly, a lot of, as you know, a lot of patients have secondary insurance as well, and that will handle the copay.
Yeah, and that's something that we discuss with the patient as they are signed up for the program. Again, we're getting an acknowledgement from the patient as they are signing up. So, you know, should they decide later that they want to de-enroll from the program because of the associated costs, and that's definitely something that we can handle for them. And then what about PPO having qualifying PPO patients? So I'm assuming that would be the Medicare replacement plans that are PPO instead of an HMO.
Yeah, I'm not sure I understand the question.
Yeah, so I'm assuming there are some Medicare replacement plans that might be PPOs, so they might have a deductible and copay. So it would depend on the patient's plan as to how the services are covered. And so we can check, you know, those patients' eligibility. And then the next question is, what about the commercially insured? So typically this program is for patients that are Medicare enrolled. Dr. Barron, are you aware of any commercial, like employer-sponsored health plans that are covering chronic care management currently?
There are some, but they're variable from state to state. So that's something that we can look into based upon the geography.
Gotcha. And then non-Medicare patients having only PPO. So that again would be the same, basically the same question as the previous question. So it would be dependent state by state, and we can, you know, call and verify those patients' plans as they come up. We haven't seen a lot of that situation. Typically, the patients who have multiple chronic conditions are Medicare aged, just in, you know, in general nature. But we can definitely, if you feel like you have a decent population of patients that should qualify based on chronic conditions, even if they're younger, we can definitely call and check those benefits. And that's something that we work with you on as the program is beginning. We provide a list of the patients who are eligible. So if you want to look over that list, exclude any patients, you know, specifically for any particular reason, you can. And then if there are other patients that you feel like weren't captured, we're happy to look into those. Let me make sure I didn't. I did see a question about billing, and I covered a little bit of that, but I want to make sure that I was clear. So how does billing work? Do you send us a file? So we can, however, we can also handle billing for you. So what we do is send those through Enable Health's clearinghouse, and those payments would go directly to your payment accounts like they normally would with any of your Medicare payments. So you can definitely, you know, build them yourself if you'd like. We can build those for you. Or again, if you're an RCM customer, we can have the RCM bill that for you. And then another question, just to verify, did you say that you come and talk to the provider? So typically we do the kickoff call as a Teams meeting with a different PowerPoint presentation that has some of the similar information. But if you feel like your providers would benefit from having an in-person visit, we're definitely not opposed to that. All right. Let me double scroll through here and make sure I haven't
A lot of
missed.
very good questions. Thank you for those.
Yeah, absolutely. Oh, one more question here. So if a clinic facility only opts for the clerical portion of the service, do you still do the monthly meeting to migrate new patients, et cetera? So this question would be related to practices that are just using the SaaS, the software. We don't have any in prognosis currently, but Dr. Barron, how do you typically handle that with other, outside of prognosis, other practices that are using your SaaS? Are you doing the data migration periodically?
We would still do the data migration periodically, yes.
We've covered all of the questions that are in here so far, but we'll give it another minute or so just in case anyone thinks of anything additional. And then again, I'm going to be sending an email to everyone with a link to my calendar as well as my cell phone number. So happy to answer any questions. Happy to, continue the conversation, provide a quote, as I mentioned. Oh, here's another one. How many days in advance do you call the patients?
Sorry, in advance of. So typically
Sure.
we would be calling the patient on a monthly basis once they're enrolled in the program. And so this is independent of the visits. These are non-face-to-face, if you will, virtual visits that are necessarily linked to in-person visits. So the timing is, again, at least on a monthly basis, sometimes bi-monthly, depending on what's going on with the patient. I'm not sure if that's addressing the question, though.
Yeah, I think the question was in relation to the appointment. So yeah, again, we're not making calls specifically related to an appointment, although one of the topics that they do cover during the chronic care management calls with the patients is making sure that they have a next appointment scheduled with your practice. If they don't already, they'll look at your previous progress note to see what the follow-up instructions were. Sometimes, obviously, it's not necessarily have a next appointment scheduled, but if it is, then we want to make sure that that appointment is scheduled. And if not, they'll reach out to your practice to make sure that you get the patient scheduled. And one of the other points on that matter is that this will definitely help with your attrition. So if you have patients who kind of drop off the radar after a period of time, this is going to help you identify any patients that haven't been seen in 9 months or more, so that you can, make sure and reach out to those patients and keep them as part of your practice. So it definitely makes the patient stickier and gives them additional touch points as it relates to your practice.
If there's a known appointment within the chart, we will, again, we're encouraging the patient to attend the appointment, but it's not necessarily a time-locked call related to the appointment itself.
All right. I think that is all of the questions that I see so far. So, okay, we'll go ahead and wrap this up. I will again be sending everyone an email with more information, as well as Dia from our marketing team will also be sending a link to the webinar. We'll also have it posted in our YouTube channel so that you can review it anytime, along with the PowerPoint slides. Again, encourage you to reach out if you want to continue the conversation. To sign up for the program, it's just a simple addendum to your existing prognosis contract. So it's super simple for us to get started. Usually takes us about 2 to 3 weeks to pull the data and information from prognosis to get everything ready to go. But we're happy to help you and happy to answer any questions, and hope everyone has a great rest of your day. And thank you, Dr. Barron, for joining us today.
Thank you. Thank you. Have a good day, everyone.